there, my name's Michaela and I'll be your nurse today. What brought you in?
I've recently been diagnosed with glomerulonephritis. I don't really know what that is.
Okay, well to start off, some risk factors are infection, immune diseases, vasculitis, diabetes, and high blood pressure.
Nephrons are the structural and functional units of the kidneys. Each nephron contains over 1 million of these tiny blood processing units, which carry out the processes that form urine. Each nephron consists of a renal corpuscle and a renal tubule. The renal corpuscles are located in the renal cortex, while the renal tubules begin in the cortex and then pass into the medulla before returning to the cortex. The renal corpuscle consists of a bundle of capillaries in a cup-shaped structure called the glomerulus, which is found inside a hollow structure called the glomerular capsule. How do the kidneys work physiologically? The normal physiology of the kidneys involves three processes regarding the urine formation and the adjustment of blood composition, which are glomerular filtration, tubular reabsorption, and tubular secretion. Glomerular filtration is a passive process in which hydrostatic pressure forces fluids and solutes through a membrane. The filtration membrane lies between the blood and the interior of the glomerular capsule. It is a porous membrane that allows free passage of water and solutes smaller than the plasma proteins. There are three layers of the filtration membrane. The first layer is the fenestrated endothelium of the glomerular capillaries. The fenestrations, which are the pores, allow all blood components except blood cells to pass through. The next layer is the basement membrane, which lies between the outer two layers and forms a physical barrier that blocks all but the smallest proteins, while still permitting most other solutes to pass. The glycoproteins of the basement cell membrane gives it its negative charge. As a result, the basement membrane electrically repels many negatively charged macromolecules, such as plasma, reinforcing the barrier based on molecular size. The visceral layer is the last layer of the glomerular capsule, which is made up of podocytes that have filtration slits between their foot processes. If by chance a macromolecule is able to pass the filtration slits, the slit diaphragms, which extend across the filtration slits, prevent almost all of the macromolecules from traveling any further. The macromolecules that get caught in the filtration membrane are engulfed by specialized pericytes called glomerular mesangial cells. Keeping the plasma proteins in the capillaries maintains the colloid osmotic pressure of the glomerular blood. Once filtration is completed, tubular reabsorption begins. This is the process of selectively moving substances from the filtrate back into the blood. Tubular reabsorption reclaims almost everything filtered, that being the glucose, amino acids, salts, and about 99% of the water, along with some other components. Anything that is not reabsorbed becomes urine. Tubular secretion is also occurring, which is the process of selectively moving substances from the blood into the filtrate. The kidneys filter your entire plasma volume more than 60 times per day. Filtrate and urine are quite different. Filtrate contains everything found in the blood plasma except proteins, while urine contains unneeded substances such as salts and metabolic waste.
What goes wrong physiologically? Glomerulonephritis, in simple terms, is the inflammation of the glomerular capillaries.
Because of this inflammation, the glomerulus is not able to effectively prevent macromolecules from passing into the glomerular capsule in the filtrate. Excessive passing of macromolecules through the glomerulus eventually causes permanent damage to the membranes, which can lead to kidney failure. Due to the leakiness of the glomerulus, glomerular filtration is not able to work effectively, resulting in proteins getting through into the renal tubules, causing a cascade of effects to both the tubular reabsorption and tubular secretion components of the process of urine formation and the adjustment of blood composition. This cascade of effects is due to damage to the renal tubule caused by the oversized nature of the proteins, which are not supposed to be present in the renal tubule. Filtration rate increases as a result of the leakiness of the capillaries and the loss of blood cells and albumin during glomerulonephritis, meaning that the amount of filtration occurred has lessened. Albumin usually floats through the bloodstream and absorbs water. Due to the loss of this protein, there is an extra fluid in the bloodstream. It causes an increase in blood volume, which causes an increase in blood pressure and an increase in urination. Normally, if respiratory acidosis or acidosis occurs, the kidneys are used to maintain homeostasis by either the reabsorption of bicarbonate or hydrogen ions. During glomerulonephritis, the leaky capillaries do not function properly, meaning that the pH of the body will stay at a dangerous level. Filtrate formation during the tubular secretion phase decreases gradually, and nitrogenous waste accumulates in the blood, causing the blood pH to become more acidic. How does that impact the overall function of the kidney? Well, 1, sodium and water retention give rise to edema in the feet, hands, and face, as well as hypertension due to an increase in blood volume. 2, the ability to regulate the concentrations of various ions in the extracellular fluids is altered. Hyperkalemia is occurring due to decreased potassium excretion. Increased serum phosphorus levels are due to decreased renal excretion of phosphorus. decreased serum calcium levels are due to the action of calcium as it binds to phosphorus in order to compensate for the elevated serum phosphorus levels. This causes impaired nerve conduction due to electrolyte abnormalities. 3. Metabolic acidosis from decreased acid secretion by the kidney and the inability to regenerate bicarbonate. 4. Red blood cells are able to pass through the glomerulus, causing hematuria. Anemia secondary to decreased production of red blood cells.
In conclusion, this is how the key concepts are impacted. The kidneys play a vital role in maintaining homeostasis. When glomerular filtration has been altered by increased permeability of the cell membrane in the glomerular capillaries and allows proteins to pass through into the renal tubules, it affects the rest of the functioning of the kidney in a negative way, resulting in homeostatic imbalances such as increase in blood pressure, metabolic acidosis, fluid imbalances, and ion imbalances, which are evident in the symptoms related to glomerulonephritis.
Oh, okay, I get it now.